Good afternoon. Thank you for joining us, everyone, today. It's our first Child Abuse Prevention Month webinar, and today's presentation is focused on how you can help prevent child abuse and neglect by reporting to our agency. Today's presenter is Elizabeth Nekoloff. She's been with the agency for 26 years and served in various roles and senior leadership positions. Currently, she is our hotline and child care room administrator. And just want a couple things before we get started. First thing to note is that we're actually hosting 2 more webinars this month on the following Wednesdays. And our next webinar is going to be all about becoming a foster or adoptive caregiver. And the last Wednesday will be about supporting our youth and families by becoming a volunteer and or a donor. So we will send out information about those webinars. Please join us again or share with someone you know that may be interested. And second, if you have any questions that come to mind during Elizabeth's presentation, please go ahead, type them in the chat. There's a Q&A section. I'll be monitoring that during the entire presentation. I'll compile it at the end. And then when Elizabeth finishes her presentation, I'll share the questions that you've asked with her, and she'll be able to answer them at that time. So that's all I have. So I'm going to turn things over to Elizabeth now, and thank you again for joining us, and enjoy the presentation.
Thanks, Kristen. Hi, everyone. I'm Elizabeth Nekoloff, as Kristen said, and the administrator of the hotline. So today we're going to talk about what it looks like if you are a mandated reporter, but this also refers to the public. Also, if you have any questions and concerns about a child that is in your neighborhood or a child that you have encountered, we definitely would want you to call also. So these, we're going to go through a presentation and we'll be discussing, what the definition of child abuse and neglect is and how you can actually make a call to the hotline and what actually happens to your call once it comes through to the hotline. So if we can go ahead and put up the presentation, that would be great. Okay, so you can, well, oh, I'm sorry. You can go to the next slide. Okay, so these are our training objectives. So we want to increase your understanding of what the roles and responsibilities of DCFS is when we receive a referral. We are governed by a statute. Everything that we do is either federally mandated or state mandated. So that is what drives our practice, not only here in Cuyahoga County, but worldwide for all child welfare agencies. We as an agency have worked over the years and continue to work on developing a working relationship and partnership to keep children safe, not only all of our children in the county, but we want to make sure that we are looking at what the impact is of the disproportionate number of African-American children in our child welfare system. This is something that, like I said a few minutes ago, we've worked on and continue to work on and will continue to work on as long as it is an issue. And that is also one of those issues that is not only, it is not unique to Cuyahoga County, it is a child welfare system issue throughout the country. And we will be looking at some definitions of what abuse and neglect is. Next. So this is just the mission of our agency. And actually I need to change that top slide there because it is, we have identified in our mission the overrepresentation of children of color in our care. So that is part of our mission now. And our vision is that we improve the lives of children as a result of our attention, care, and support. And we can't do any of this without community support and without the eyes and the ears of those out there that are working with or living next to the children that are most vulnerable in our community. Next. So this is just a slide that I like to put at the beginning of what we're talking about. You can see we currently have 638 Caucasian children in our custody and 1,490 African-American children. So you can see there already that that's a disproportionate number, almost 2 times, a little bit over 2 times the amount. So it is something that we continue to look at as they come into the system and make their way through the system, the gap gets larger. In the beginning, there may be a closer representation of each, and then through every decision point at the agency or through the life of a case here, the gap gets wider. We have on the hotline, we did a study recently looking at blind screening when we were not looking at the race or ethnicity of a child that a referral was made upon. And it was determined that as a county, when we are looking at screening, there is no differentiation in our screening practice when it comes to children of color or Caucasian children. And one of the things that we like to ask mandated reporters and those in the community to think about is, if all things are equal and you have a Caucasian child and an African-American child, are you calling on both of those children? Especially mandated reporters that come into contact with these kids. And we as a society need to recognize our own biases and how culturally competent we are when it comes to how children are raised or disciplined and what that looks like for different cultures that we encounter. Next. Okay, what is abuse and neglect? You can go to the next slide. Okay, so neglect is an act of omission. So if the child is, if a parent is not meeting their child's needs, food, shelter, safety, education, clothing, medical, one of the toughest things is obviously during school time. We know a lot of children in our community are fed at school. So does this become a bigger issue during the summer for some students or in the evening hours? And we also do know that some schools send food home. So when we're looking at this, we're looking at how this impacts a child. If a child is not getting their medical, and that could be a child who's diabetic. Sometimes the concern becomes, if you have a teenager who's diabetic versus a 2-year-old or a 5-year-old, a 16-year-old may be responsible for their own medication. So we look at that a little differently also, talking about, well, if mom and dad are taking the child to the doctor, getting all the medications, is it neglect? Is it medical neglect if the child isn't giving them their own medication, taking their own medication? So these are things that we consider when you're making a call to us. Next. Neglect indicators. So if you see a child who's withdrawn, depressed, craving attention, there's a big drop in grades, you know, some things, some little increments of things are good, are okay, but when they start to add up and these things start to impact how a child is growing or how a child is learning, then we really need to consider what's going on at home. Chronic lice, that's one of those issues that we deal with, where it's have the kids been treated? What actually is the issue regarding the lice? Is it that we've treated the kids, but we haven't treated the home? So what are parents doing about that? If the child is to the doctor and has been diagnosed with lice, have the parents gotten the medication? Wearing the same clothes for several days and unclean. Some kids may not have a lot of clothes. So we also battle the difference between neglect and poverty, which is something really that we need to try to keep our focus on. Is it that they cannot afford to purchase the clothes, or is it that they're just not purchasing clothes? So those are things to keep in mind when you're looking at making a referral to the hotline. Next. So another category that we look at is dependency. So one of the biggest things here, and I like to always try to give the easiest example because there's always some outliers. So if we have a parent who has their own mental health issues and they may not be able to take care of their child through no fault of their own, that's more of a dependency, not a neglect or an abuse. The parent may be willing and have all the intentions, but is just not capable. A homeless child without adequate parental care. So say a parent has left or even may have passed away. Those are some of the calls we do receive. And we do like for families to make their own plans for their children if there's not a parent figure around. However, we do have to make sure that that child is safe and not at risk of any other abuse or neglect. Next. Educational neglect. So we deal a lot with the schools. CMSD, Cleveland Municipal, is one of the biggest referrals we have, also hospitals. But when it comes to educational neglect, there is a new bill, it's House Bill 410, which actually is a little different than up here, regarding what is the school's responsibility before they call us. There are certain things that the state of Ohio has asked schools to do before contacting us. So they have to follow those procedures before they make the phone call to us, because my hotline staff will be asking them if they've notified the parents, if they have tried to get the parents in for a meeting and things like that. So educational neglect is one of those things that we work really hard to prevent kids from coming into contact with us for, unless there is really a bigger issue in how it's affecting the child. I can give an example. We got a call the other day from a school stating that the child hadn't been to school, but that the child was passing all of their classes. So you can understand from our perspective, those things don't kind of add up. How is it that a child isn't coming to school, but a child is doing well and passing all their classes? So, and it wasn't a virtual school. So those are things my staff will be asking for when and if you make a call. Next. Abuse and active commission, something that has been inflicted upon a child. The two major types are physical and sexual abuse. You can go to the next slide. So these are some physical indicators. And one of the things that is not in my presentation, especially when it comes to physical abuse, are actual pictures, because I think people get honed in on pictures and think that that's what it should look like all the time. And that's just a false sense of knowledge. So we wouldn't want you to be looking for this particular look. So we just let you know, if you see a child with like linear bruises, welts, burn marks, bruises with specific shapes, you should be able to tell a bruise of a child who like ran into something versus a bruise from being spanked. They look different. Bald patches, human bite marks, bruises to the face or the neck. And of course, there'll be, those bruises could be in all different places, especially if you have an older child who's kind of trying to run away or duck and weave out of the line of the belt or a switch or anything like that. So some behavioral indicators that there may be some physical abuse. You may have kids that are wearing inappropriate clothing for the weather. So if it's 80 degrees and a kid comes to school and is in a coat and is in a sweatshirt, and that's not what they've looked like before. We do have kids that wear sweatshirts all year round. That's not a child you're looking for. You're looking for if there's been a change. So if that child all of a sudden is wearing a hoodie in the middle of summer, and you've suspected some things, you may want to further ask those questions. Fear of specific individuals. If there's any withdrawal, regression, aggression, looking for behavioral extremes, if they went from one thing to another. Unbelievably explanation for an injury. If they give you this real elaborate story and you're like, you can't really piece it together, you may want to ask some further questions and call the hotline. A child that's reluctant to go home. We get those a lot of times when children are at school. We do get calls saying child's refusing to go home or is afraid to go home. And we do investigate those. Those are ones that we will go out and we will talk to the child, try to determine what's really going on and what is the fear. Because sometimes there can be a situational thing that happen and the child's like, oh, well, my mom said if I failed the test, this was going to happen. So we do our investigation and then make a decision what should happen next. Next. When you're looking at physical abuse, we look at where is the injury, what is the size and shape, is the injury consistent with the story of the injury consistent with the injury itself. So one of the things, when you call the hotline, they will be asking these questions. You don't have to know the answer to them, but it's helpful if you do. It's helpful if you can describe what you see or describe the situation as the child has reported it to you. So it's our job on the hotline to make sure we're getting all the information that the referent has to give us. And we are required to call you back as the referent to see if you have any follow-up information. So if you make a call to the hotline and the social worker assigned to the case calls you back, they're calling you back just to see if maybe there was something that you forgot, or maybe when they're reading the referral, they have a different question than the hotline worker had. So they will call you back to try to get more information. Next. Physical discipline. When I talked about earlier being culturally aware, you need to know we need to know what we're dealing with when we go into the home, and we would ask you some questions that may relate to what their culture is. What do they mean by spanking, beating, whooping? Because that means different things to different cultures. So we like to make sure that we know what we're dealing with, like what did the child say, what was going on, and is this an excessive discipline? So there is no law that says you can't discipline your child, but that there are laws that say you can't abuse your child. So what does that look like? And that's a conversation that's been an ongoing conversation and will continue to be an ongoing conversation forever, because people look at it differently. So we try to keep that in mind, and we try to meet people where they're at and try to make them understand where they're coming from also from our end. Next. Emotional abuse, chronic acts which interfere with the psychological development of a child. Emotional abuse is one of those things that is oftentimes, I will struggle with how to put this into words. The effects of it doesn't happen for maybe months to years later. So you have it because we want to connect a behavior to the words. So if I tell you you're stupid, or if I tell you you're not going to be anything, and then you're going through life and you're fine, there's a difficult time connecting the two. But if all of a sudden your grades start to drop and you start to act out and it's impacting you differently, then we can have that conversation, like what's going on. And if it's, mom or dad tell me I'm stupid, they tell me I'm not going to be anything, so I just am going to make them believe that. So this is why I'm acting up in school. This is why. So we have to connect the two to make sure that we can make a finding when it comes to emotional abuse. Next. So these are emotional abuse indicators, are sometimes just the same as physical indicators: sudden weight gain, weight loss, vomiting, nervous disorders, behavioral, poor relations, fire setting, withdrawing, age inappropriate behaviors, habit disorders such as biting yourself, rocking, head banging. And so when I look at the biting, rocking, and head banging, we also need to differentiate. Those are some characteristics that children with autism might have also. So, there are a lot of things that kind of overlap in different areas. So we're just make sure that we're dealing with a child that this behavior wasn't there before and now it is. Okay, next. Sex abuse, any activity involving children who are not of age or developmental capacity to consent to such activity. So we have a sex abuse unit here that handles mostly the cases they handle are incest cases as a ongoing unit, but as a short-term services where they do the investigations, they investigate all sex abuse allegations. This could be child to child, this can be adult to child. There is a differentiation with age. There's an age, I think it's a 3-year age difference between like a 15 and a 19-year-old. That would be, we would look at that as a sex abuse versus a 15-year-old and an 18-year-old. So we look at everything, whether it's sexual harassment, touching, penetration, pornography, all of those things. If you have a concern about it, please call the hotline. We will investigate if it falls into our screening guidelines. Next. Sex offenses, rape, sexual battery, unlawful sexual conduct with a minor, gross sexual imposition. So we also like to remind people, our job, what we do and what the police do are two different things, and what we'll consider our burden of proof or what we're looking at. The police are looking, and this goes for all of this, the police are looking for whether a crime has been committed. We're looking at whether a child is at risk of abuse or neglect and what our standards are versus a criminal standard. Next. So sexting is also illegal when it comes to minors. So we try to make sure that everybody is aware of that. And we try to, when we talking to kids also, like letting them know if you send something to somebody else and it gets sent somewhere else, you know, this is kind of one of those things we want to stop in the beginning so it doesn't get to that point. But we do look into that, and we have to make sure also that, is it something that some teenagers are doing? Absolutely. Does it rise up to the sex abuse accusation? That's for our sex abuse to determine. Next. Okay, here goes some indicators that you would be looking out for. Some of them are pretty self-explanatory, and one of those things that we see, a behavioral indicator about cruelty to animals is a big one. It's kids are taking out their frustration on usually an animal and sometimes younger children. So we have to look at that and determine, okay, where is this all coming from? And we also, if it is a child on child situation, so say you have an 11-year-old who has done something to a 6-year-old, we also look at that 11-year-old as a child that something has happened to them. So we don't make them what in the system is a perpetrator, we make them an other involved child, because the likelihood that something happened to them for them to do that to somebody else is very great. So we not only are we looking at how we can help the 6-year-old, we're also looking at how we can help the 11-year-old. Next. Good touch versus bad touch. This is one of those things that, as somebody that's out there doing this work, or as a neighbor or a friend, or even a parent, right? We tell our kids about bad touches, but then somebody touches their body and it makes them feel good, as uncomfortable as that might be to us. Then we're asking them about a good touch, bad touch. It might make them feel good, so they don't say that it's a bad touch because it made them feel good. So that can be very confusing to a child. We ask that you talk about, has anybody ever touched you in the body parts that cover your bathing suit? So those are just some little tidbits to kind of shy away from good touch versus bad touch, and really kind of having more of a conversation with a child at their level and what they understand. Next. Who should make a referral? The answer to that is everyone who's concerned. But these are what falls under mandated reporters. And this is not an all-encompassing list, but it is the list that we have. If you want the whole list, you can go to that Ohio Revised Code there. I talk about school districts a lot because we deal with them a lot, and it is etched out as a mandated reporter that in the school system, every single person that is employed by that school system is a mandated reporter. It's not just the teachers, it's not just the principal, it's every employee. So even the janitor is a mandated reporter. So next. When and how you should make a referral. Next. The person making the report shall make it to the Public Child Services Agency, which is us, which is 696 Kids 5437. And for any child under the age of 18, any developmentally disabled person, and any physically impaired under the age of 21. So if you have someone who's physically impaired at 19, you can still call the hotline and we'll make a determination if it warrants an investigation on our end. That's the same thing for developmentally disabled individuals. Next. That's the number I just gave you. Next. Yeah. So this is just our roles here. So at the hotline, which I oversee, we accept referrals by phone, by fax, by walk-in, by email, and by mail. When the pandemic started, we quickly developed a mailbox, an email box, so that people can make referrals via the internet. That was the first time. So it's been up since roughly probably June of 2020, maybe July of 2020. And we've actually gotten close to 2,000 referrals that way. And we have had people send us videos. We've had people send us Instagram posts. So it is a good way for people to let us know what's going on without having to call in. But they also leave us, we encourage everyone to leave their phone number or an email address that we can contact you back if we have questions. It's not mandatory, but it is a nice way for us to reach back out and follow up if we have any other questions. We have a no wrong door policy. We supply the public with information regarding outside agency referrals. We assess the calls and assign them. We have after-hour responsibilities. We do safety assessments and planning. So the hotline here in Cuyahoga County is 24 hours a day, 7 days a week, 365 days. Even when there's snow, even when it's freezing cold, my hotline staff is here answering calls. Next. So information that's helpful when receiving a report: the name and addresses of the child's parents, or the persons who have custody, if it's known, child's age, the nature and extent of the injury or the abuse or neglect, what is suspected to happen, what information. So when you're calling in, any information that you can give that will make it simpler for us to make a decision or even locate a family. We have people who call who say, well, I know they live in the blue house on this street, I just don't know the address. Okay, we have a way to go in the system if you know mom's name, dad's name, child's name, to see if they're already in our system. So if you have a name, we can always look up things by name. If you have an address, we can look things up by address to even determine if, because sometimes people call and they're like, I don't know who lives in this house, but this is the address and I have some concerns because I've seen some kids going in and out. And if they're active in our system, we can look them up via address and realize, okay, well, they're according to our system, there might be some kids that live there. So what ages of the children do you think they are, without giving information about who that family actually is? Because we do have to remain confidential about anything that's in our system. Okay, next. Like I said, any other information that you might be helpful. And in educational neglect cases, we do ask for attendance records, or we do ask, like I said earlier, what have you tried? Have you followed House Bill 410? So next, what happens when you make a referral? Next. So this is pretty basic. You call in, my staff is connected to the state system. So they are typing in the state system to determine if there's been any history, what the information is that you give us. Once they document all your information in what's called a referral, they hand it over to the supervisors, and the supervisors then make the determination if that actually gets investigated. And we use screening guidelines that are set forth by the state. So what I like to tell people is, you have to realize that there are 88 counties in the state of Ohio. So there is no way that those screening guidelines can incorporate everything all 88 counties encounter. However, we do have to look at it based upon our area. So perfect example for me is if we get a call saying that there's a dad in the backyard or a mom in the backyard teaching a child how to shoot a gun in this small area. That's going to be of concern to us. But if we're out in Southern Ohio and they're in this big backyard and there's woods everywhere and there's no neighbor, that's a cultural difference. That's something that they do that is okay in their neighborhood or their county. So those are things that we have to consider when we're looking at the screening guidelines. But there are some pretty clear-cut ones that we do screen in. And every county in the state of Ohio does things a little differently. Then we need to determine on our end whether it's what we call an emergency or a non-emergency. And for Cuyahoga County purposes, an emergency would mean that we are dispatching someone to make contact with the child within an hour. A non-emergency is we are dispatching somebody within 24 hours to make contact with the child. During normal business hours, that case will be assigned to a child protection specialist in our short services area. After 4:30 and on the weekends and on the holidays, the hotline will be responding to all of those calls. Next. Investigation, parental consent when interviewing children. There is an Ohio law that says we cannot interview a child without parental consent unless we have exigent circumstances. So one of the easiest ways to explain exigent circumstances would be if we have a child that's at school and who's afraid to go home. And we need to make a determination really quickly if that child should or should not be going home. Other than that, everything is really a case-by-case basis. And we have to really believe that a child is in immediate danger of harm to be able to go interview a child, because parents do have the right to determine whether we can interview their children or not. If we are without consent and we have concerns, we should be consulting with, the workers should be consulting with their supervisors. Next. These are dispositions. So these are, once we go out and investigate, we should be, in our investigation, we should be making contact with as many people as possible that we need to contact in order to make the best decision. So if we have an educational neglect, seems to be my topic of discussion at the moment. If we get an educational neglect referral, we certainly should be talking with the school, obtaining school records, talking to the child, talking to the parent, seeing what the issue is before we make a determination. Just like if there's a physical abuse, say a child has a broken bone, we should be talking to the hospital. Does the hospital believe it was inflicted? How old is the broken bone? Is mom or dad's story plausible? Could this be something that happened if we say that a child fell and broke their collarbone? Where did they fall? What did they hit? We should be going to the home to see if that even, they hit the table. Well, let's go to the home. Let's look at the table. Let's determine if that's even possible with the height of a table. So once we've done our investigation, then we need to determine whether we believe that it did occur, which means it was substantiated. If there are some things that indicated that something may have happened, but we are not certain, we can do an indicated finding. And if we go out to the home, or if the hospital says, after further investigation, we note that the injury is consistent with the story, it is something that is plausible that did happen, that could have happened, then we could unsubstantiate that. Or if we go out to the home in an educational neglect situation and we determine that it's a teenage kid and mom or dad are dropping the kid off at the front door every day, but the kid isn't going in, or is going in one door and out the other, is that mom or dad's fault, or is that a decision that that child has made? So we take that all into consideration. Next. This is the case flow. So the hotline workers, I just spoke about. Short-term services completes assessments, determines the family needs. Short-term services can work with the family for up to 90 days and then close a case. Once a court becomes court involved, it goes to our extended services area. So they're responsible for developing a case plan, providing, helping provide placements for the children and things like that. That's what our extended service staff does. Plus, for those children where parental rights have been terminated and they're up for adoption, they're also charged with trying to find an adoptive family or permanent living situation for that child. Next. Reporters, reporters are confidential. That is, we should not be divulging who the referent is. If you were to make a call to the hotline and you did not want to leave your name, that is okay. We ask that you do leave your name just in case we have follow-up questions. But we should not be divulging through to the family who called in. But we can say, just like we all would know, right? If somebody comes to your house and says, I heard such and such, and the only place you've been is the doctor's office, you're gonna know that they heard that from the doctor's office. Parents are the same way. If the baby's low weight and has lost weight and they just went to see the doctor and the doctor called it in, and we go out there and say, hey, we're here to check in on the baby. We've heard, they're going to know the doctor's office called us, but we're not there to go, yes, the doctor called us, and we shouldn't be going into the home and saying, got a call from the doctor's office, or we got a call from your neighbor. Those are, that is illegal for us to do. So we work really hard trying not to do that. All right, that's my presentation. Any questions?
So Liz, let me just tell you that we had one come in, which you just kind of addressed, but it was one that came in through the chat box. And if anybody else has other questions, you can either type them in the chat, type them in the Q&A, or you can unmute after I ask this first one. But the first question came in from someone that says they work at a school, and the last few times they've called, they were told, they told the teachers, our staff would have told the teachers that the teachers had to give their name or the report wouldn't be made. And she says, this person says, I thought it could be anonymous. Am I wrong?
Yes, it can be anonymous. I think there might be also some discrepancy if a school is calling in, right? And you don't give your name as the teacher or the person at the school, you will then not get a caller ID. So as a mandated reporter, if you're a mandated reporter, you are able to get what's called a caller ID, which is the actual referral number. So if you need to call back in. So if you don't give your name, we can't give you that number. But the report should clearly still be made, and it still should be in our system. Because you are allowed to make, anybody is allowed to make a referral and remain anonymous. It's just when it comes to mandated reporters get an extra piece of information just in case they call back to follow up.
Great, thank you, Liz.
Mm-hmm.
So far, that's all I have. Did anyone else have any other questions? Give it a minute. Okay, Liz, I had another one come through in the chat or in the Q&A. It says, up until what age should neglect be reported? They work in a high school and they were told there is a max age.
The max age would be when they're 18, if they're not physically or developmentally delayed. But even after, if they are physically or developmentally delayed, the max age, I believe, is 21. So it does, I think it comes into that tough situation, like I just spoke about earlier, is the neglect on behalf of the parent, or is it that the parent's doing certain things and the child isn't following through? I think one of those things, one of those easy statements, like we hear kids say all the time, or even maybe in your own home where people are like, well, there's nothing here to eat, or there's nothing at home to eat. Well, that has a lot of different connotations. Like literally there could be nothing at home to eat, or it could be there's nothing at home that you want to eat. And that's a different conversation, along with, culturally people have a mindset and our own biases. And I can tell you just from a personal story, somebody once told me that, to feed your kids fast food is neglectful. And I had to chuckle because I'm like, I must be the most neglectful parent there is, because if you're if anybody's involved with sports or anybody does anything after work or anything, you're in your car a lot of times, and it may not be the best meal to feed a kid, but it's a meal. So I think we have to be mindful. So if you have a child that's in your school and is 17 and you believe that child's being neglected, certainly call it in.
Thank you. And then one from the chat, I'm just going to try to get everyone in order here, but Debbie said, what happens when a parent won't meet with you?
Well, parents, I know people don't like to hear this, but parents have rights and they have the right not to meet with us. However, we also have the ability to we have prosecutors here in our agencies, from the county prosecutor's office for our division that we can have a consultation with and present, this is the situation. Mom and dad won't meet with us. Do we have any recourse? Can we take it to court? Should we take it to court? What does it look like? So we have a way to then have that conversation with our legal department and make a determination that, you know, if they don't want to meet with us and these are the allegations, in some situations, they may say, you know, close, parents refuse to work, or they may say, you know, we might want to take it further, go ahead and set up a meeting, and then we'll go from there.
Okay, another question was, in terms of your blind screening process, do screeners look at address and location? How blind is it?
So what normally happens with my staff is the way it works is when they look at, they may get a hard copy of the referral, but literally they're looking at the top of it to see what the number is. And when it opens up on the screen where they're making the decision, the only thing that opens up in the screen for them to make the decision is actually the allegation itself. So normally, unless it's a child wandering, this is my easiest example. Unless it's a child wandering, we normally don't get in a narrative that African-American, you know, Johnny's an African-American boy who attends this school. We don't get that. We'll get Johnny is 15 years old. He hasn't come to school. But if you see the kid, if somebody calls and said, hey, there was this kid wandering the street, it was a Caucasian boy, he looked about 5 or 6, that's a different referral. And we'll have that information, but normally that information isn't in the body. Neither is the address of the family.
Amina, did you want to ask your question, or do you want me to just read it?
Can you hear me? I'm sorry.
Yes.
Yes, we can hear you.
So I work in the school too. Usually once the cases are open, like how long and they find them unsubstantiated, how long do they normally just like keep a case open?
You know, it all depends. It all depends on what the situation is. Just because it's unsubstantiated doesn't mean that the family doesn't need any services or any assistance. So it's really done on a case-by-case basis. We try to make sure that we're not impeding a family's right to have, you know, us not be in their lives. So if we can go in and we can assess the situation and make a determination and provide any services that they may want, then that's what we'll do. And sometimes that can be 30 days, sometimes that can be 45 days. In our short-term services area, we can, you know, they can work with the family up to 90 days. However, that could also be determined by the family. The family may feel like, okay, it's unsubstantiated, I don't need any assistance, I don't want any help. But there may be another family that says, although, you know, you unsubstantiated or you're looking to close the case, can you help me do this one last thing? Or can you get me in contact with somebody that can help me do this? And that's what the worker should be doing.
Okay, thank you.
You're welcome.
I have another question from Amy. She shares that she has a patient that they referred for a wheelchair clinic. He's in need of a power wheelchair due to muscular dystrophy. and that his mom missed her appointment yesterday. The school therapist is worried, and they have been referred to DCFS before. Mom usually brings him for appointments, but has poor follow through. She says, I know that in general, a missed medical appointment does not meet criteria for a referral, but I assume that missed appointments with special needs children are more serious.
You're 100% correct. And if there's a documentation, it's just, and like you said, it's just not about the missed medical appointments. It's also about when she does come and is she following through? If she's not following through, you can consider that neglectful, especially if it's something that is causing the child, some undue harm. If that's what the child needs to function, it would be the wheelchair, and mom's not following through and she's been provided resources, that could be considered neglect. So I would certainly, get all your, ducks in a row, as I want to put it, and, be able to say when you call the hotline, these are the appointments that she has come to, these are the appointments she hasn't come through. But our bigger concern is not the appointments that she hasn't come through, although those are a concern. It's also her lack of follow through to get the child what he needs to be comfortable.
Liz, next question. They say that you earlier in the presentation, you had stated even a janitor in a school is a mandated reporter. Does that hold true for a county worker that is not a social worker? So I'm assuming if they work at like Job and Family Services or.
I don't believe so. I don't believe it's the same threshold.
Next question. If there is a sexual assault by one student to another, should a report be made by the school aside from the report to the police?
Yes. Because once again, you're making the report to the police, and they're going to be looking at it as a criminal situation. We would look at it through a different lens. It doesn't mean that we would open the case or investigate the case, but it would be definitely something you would want to call it, because we'll be looking at a variety of things. And one of the things you have to also remember, we also have access to other information that we may be able to start to piece things together. So, one of the things that we do look at is, like, even in some of those cases where you may not know mom's name, let's for instance, or dad's name or the address, and all of those situations still get documented in a system. So if we get another call and we can start piecing together, like at, say an address of, let's just use 3200, Detroit, but we don't know mom and dad's name, or you don't know mom and dad's name, and then we get another call, and that person does know mom and dad's name and does know the address, then we can link those together. So.
Thank you, Liz. Another question comes through. An example here they shared was a parent of hers had been pushed through a glass window by their boyfriend. The students were there and witnessed this. They were left alone in the house with the boyfriend when mom went to the hospital. This person called 696 kids, and then mom called the next day to yell at me. She called my boss and wanted me fired. She also told me that she was going to jump and beat me up after school. What are the laws protecting the mandated reporter?
Oh, what? I don't have the answer to that. I mean, if obviously we're not supposed to disclose who it is. However, if by process of elimination they figure it out, I would say contact the local police and make a complaint that she has threatened you and things like that. That's your protection as a mandated reporter, or technically any reporter.
Next one is another from someone says, earlier in the presentation, there was an example of children possibly not receiving support due to an older adult having difficulty caring for themselves as well. How does DCFS work with DSAS to support both the children and the older adult, while trying to ensure the safety and well-being of everyone in the home, with the primary goal of trying to keep the family together if possible.
Well, if need be, if we need to make a referral to DCFS, we will, and bring them in, because we work hand in hand, much like we do with other county entities and other entities such as Frontline, where we work hand in hand with them when children witness a murder or any type of violence. We try to bring in other people to make sure that they can provide the services that we can't. So if we go out to a home and we see that, even just for instance, if we go out to a home and we have a mom who's actually caring for her mom, and that mom is incapacitated and she's not being cared for, it's our obligation then to call DSAS and inform them of that issue also.
Thank you, Liz. And another one came in. It says they have a student that reported that she was sexually abused by a nephew that was living with them. When they called it in, the worker told us we should also contact the parents. I said that I would not be calling the parents because I believe that they may try to harm the nephew before DCFS or police would show up. I believe the intake worker was wrong. What should have been done in that situation?
Well, that's I think part of it is maybe not, the worker would have thought to inform the parent so that the child can get the needed help that the child needed. I don't think their mindset was on what the parents might do to the nephew versus really what the child actually would need from their parent, like support, like, do I need to go to the hospital? Do I need to be seen? So I think it's kind of a twofold kind of thing. It's kind of what I want to call a sticky wicket, because it's like, we would also want the parent to know that we're coming out. Because a lot of times as a mandated reporter, we are obligated, like I'm a private practice therapist in my other life. And as a private practice therapist, I'm obligated to tell a parent that I'm going to be making a referral. So I do, so that may be where the worker was coming from and trying to get ahead of it and saying, could you please let mom know that this has happened to the child so the child can be seen? And maybe that wasn't conveyed in the best way. But that's what's actually good about doing these mandated reporter trainings and conversations, because then I can have follow-up conversations with my staff about, what I'm hearing from the public and the people that are calling through the hotline, and how we can do a better job of making sure that we're being very clear in what information we're providing to the public when they're calling in.
Thank you, Liz. So we just have like one more minute. If anyone we could take one more question if anyone wanted to submit it or say it. Lots of thank yous too, Liz, just so you know.
Oh, you're welcome. And if some of you are mandated reporters out there or work in the schools or wherever you work, and you want me to come to the school, or you want me to do a presentation via Zoom, you can call me. My number is 216-432-2627. And I would be more than happy to come out, have a conversation, talk about things, and do a more of a, in-person kind of thing.
That's a great offer. Thank you, Elizabeth.
You're welcome.
Okay. Well, I think that's all for today. Thank you everyone for attending. Thank you, Elizabeth, for your time and for your expertise.
Oh, welcome. You're welcome.
I did have one question about the PowerPoint, and yes, we can share that out with participants afterwards. Just as a point of reference, we just like to make sure no one tries to do the presentation on their own, but we do like to share that with people afterwards. So thank you for your time, everyone. Have a good day.
Thanks, Kristen. Bye-bye.
Thank you.
Bye.